The first question was already put to me, and it comes from Steve. What are some of the common enabling behaviors children do when mom and dad or both are addicted?
Well, it's tough. They're enabling behaviors. I tend to want to call them survival behaviors. So what are some of the things boys and girls do? They deny that there's a problem sometimes. Often they don't feel safe enough to speak their truth, at least at home. Sometimes they take on adult roles and responsibilities around the house. Often they walk on eggshells and want to do the best they can to avoid conflict and difficulties, want to smooth things over and keep the peace. Taking care of younger siblings. And often we'll see that role reversal when people are active in their illness of a substance use disorder, where the kids sometimes become the parents and the parents become the kids. We'll have kids putting parents to bed. We'll have, sometimes people in their disease taking money out of their kids' piggy banks instead of putting money in. And all of those things. The difficulty with all of that is boys and girls are just trying to survive. They don't know any better. And sometimes they think they're the only ones who are dealing with this. And the reality today, and I wanted to make sure today that what I really wanted to do was to try to put a face on this and not throw a bunch of statistics at you. But we're talking about somewhere between 1 out of every 3 and 1 out of every 4 kids across America. Used to be 1 out of 4, and then this opioid epidemic has just, pushed those numbers up.
Thank you. All right, we got 2 more questions so far from Beth. Will you repeat what you said halfway through about kids are at risk to be abusers because they don't know how to deal with vulnerabilities? It was important, but I can't quite remember how you phrased it.
So say that one more time, Robert.
Will you?
Sorry, can I jump in? I shouldn't have said abusers. I meant substance abusers. That they're at risk to be You said earlier on how people talk about there's a predisposition, or if the parent's a substance abuser, they're going to be a substance abuser. And you said it's not that necessarily genetically they've inherited, but that's something about that they respond to vulnerabilities the same way. How did you say that?
Let me make sure we get this right. And thank you so much for clarifying. The craziness of doing this through Zoom is, I can only see a few of you. I'm traveling blindly. So thank you for the bit of clarity. What I was saying is that besides that biological vulnerability, environment also plays a part. And, and then for a lot of kids, it's that psychological hurt and pain. It's that trauma that's involved. I mean, my goodness, you look at people in treatment today. What are a lot of them trying to, what are a lot of them trying to do is go back and deal with that trauma that happened to them when they were kids in all of this. But the point I want to make is sometimes, I see this with a lot of folks in recovery. They're in recovery now and said, oh my goodness, I think my kid's going to get this disease. And it's like, slow down. We don't know if your child's going to get this disease or not. How about we empower them with some living skills? And one of the things we teach in the children's program is this, that if you don't pick up a drink or drug, addiction can't grab you. And part of what we're always trying to do is push back age of first use, push it back. And that, we see people come into treatment all the time and they're starting drinking or using at younger and younger ages. So does that get at where you, is that getting it at part of what you wanted?
I think so. I wish I had an automatic memory that I could pull up the sentence that you said so perfectly. And because the essence I think I got from it was, it's not that biologically they're predetermined, but it's more that they may wind up handling things the same way because that's what they've learned, I think is what you were saying, like that's going to be their response to the stressors of life, which also leads me to think, what about all these kids that have been adopted or in foster care early on? I wonder, I'm sure there's statistics out there about how likely they are to become substance abusers.
It's the kind of thing that, so many people grow up with this disease and get it, but there's so many people who grow up with this disease and don't get it. Mm-hmm. And I think we need to focus on that as well. And, I'm after parents and grandparents, and you made a really important point, adopted parents and foster parents, and getting them to see, we don't know what's going to happen. Come on, don't create a self-fulfilling prophecy here. But how do we continue to give kids skills and tools to deal, with the complexities of living on a daily basis? And the more of those skills, and for all the recovering folks on the call this morning, think about what recovery is. We're learning those skills and tools. That's how we maintain our sobriety. We know we're learning what to do. Family members as well. So thank you so much.
Thank you.
Appreciate it.
Our next question comes from Reverend Colbreth. Either you can ask it yourself or I'm happy to ask it if you want to. It says, what impact has virtual school had upon children in addicted families since these children look to school as a safe place?
It's really hard. I worry and I understand. And I'm not an epidemiologist, but I'm worried for kids. Honestly, I'm worried for all kids that are doing virtual schooling these days and the missed opportunities for social and emotional development. I mean, that's tough. I've got 3 grandkids that have been doing virtual school since last March, and I just worry about the long-term impact. I think that there's a couple of things to add to it. And for the Reverend who asked the question, it's a great question. And I would say this, that whenever we have a tragedy in America, and we could talk about when the federal Murrah building was blown up in Oklahoma City, when 9/11 took place, Hurricanes Rita and Katrina, a couple of things happen. One is that many people who are in recovery from a substance use disorder relapse. And there could be many different reasons why they relapse. Let's not get into that part of it. So the impact that I see on kids is that, and think about what happened at the Capitol less than a week ago, in Washington, D.C. When those kind of things happen, little kids need someone to explain it to them in an age-appropriate way, to reassure them, to help them see that they're safe, to talk about the dynamics. And if a person is, in their disease, they're not capable of doing that. And so then kids are missing out on that part too. In terms of the pandemic, think about all the kids that are home and that don't get the opportunity to go to school right now, that don't get the opportunity except virtually to practice their faith or to play soccer or to be in band. And so kids can get isolated, during this time. And I think about the other thing is that, gosh, virtual world is crazy. And I see with my own grandchildren how much extra help they need and how much guidance they need in order to just be able to do school on Zoom. And fortunately, I have a grandmother, my wife, that's helping them, and their parents are helping them. But when a parent is preoccupied with their substance use disorder or with a loved one's substance use disorder, how much time do they have to help kids that are dealing with all just the difficulties with school itself? So a lot of difficulties go on in all of that. And we need to have people explain to children what's going on, or again, they'll make up a story or they'll feel that it's not safe.
We have a question from Anna Pierce. I'm going to invite her to ask about DFCS.
Hey, I'm one of the Savannah Chatham County Public School counselors, and I work in an elementary school setting. And I think DFACS is overworked. They don't have enough resources. I think anyone would admit to that. However, I guess one of my frustrations working with students who I can't say, I don't diagnose, so I don't know that the parent necessarily is an addict, but I know that there are definitely troubling behaviors related to either substance use, alcohol, drugs that the kids will tell me about. And oftentimes it will be information where I have to make a DFACS report, such as, them describing behaviors about driving in a car after mom had been drinking and obvious impairment, or the child taking care of mom at home and being the parent at home. However, in my experience, I feel that the feedback that I get back from the caseworkers is being an addict does not mean that they're neglecting their child. And I say, absolutely, you're correct. But when these behaviors occur, I do consider that neglect. That's what we're taught. And I guess I just, I don't know where to go when we don't have a whole lot of things that we can do here besides relate to the child, support the child in that way. But ultimately, if DFACS can't step in, where do we go from there? And why is that? If that's unsafe to me, those behaviors. So why is that being classified? And this is over a variety of times. It's being said that that's not, just because there's addiction there.
So let me answer that in a couple of ways. And thank you so much for asking the question. And thanks so much for what you do, because there's got to be boys and girls that you're their safe person. And they're coming to you because they don't have anyone else to go to. But your frustration, I see it, I feel it, is that you can only do so much. What else do we have for these boys and girls? What else can we be doing for them? So, I mentioned, I want you to write down this website. It's www.NACOA, NACOA.org. And I know that the Savannah Interfaith Coalition is starting to work with NACOA. And there it is. It's in the chat box. Thank you so much. Thank you, Rabbi Robert. You're always right there. What would I do without you? We're going to take this show on the road, but I got to have you with me. And then I'll certainly get you those Elmo autographs you've been looking for. There's some wonderful resources there that you could use with students when they're with you. And I got to tell you, we're making child abuse reports, suspected child abuse reports all the time. And that I think that a way to advocate for children is I need to make that report. Not only am I mandated, and I take that incredibly seriously, that to make those reports. And often, as you're saying, nothing becomes of those reports, but I still need to report it. And sometimes the squeaky wheel gets the grease. And if they hear that enough times, but there are some more resources that you can use. We just need more programs. I mean, that's really the bottom line. One of the things that we've been doing here, just in a sentence, because I know there's some other people that have questions, Mrs. Ford, Betty Ford, 21 years ago said, we need to go to the schools because that's where the kids are. And so we actually have a program that we bring into the local elementary schools. And so it's the counselor, it's a school counselor and the principal that pick the children. And then the principal sends home a letter that we help write. And the way the letter is written, it's very carefully written. We're not trying to fool anybody or trying to pull the wool over on anybody, but we say it's a prevention program for boys and girls that come from families that have been hurt by addiction. They've been hurt by alcohol and drug use, and leave it at that. And those programs, they work really well. Actually, we did our first 2 virtual programs in the schools. And we got to go to where the schools are. That's where the kids are. But we cannot expect the schools to do all of this work. It's got to be a school community partnership. And I think where you're really getting caught up right now is just that we need more resources. And I think that the Savannah, Interfaith Coalition is going to keep working on that. We just need to work more closely together